And tonight there's growing concern about how the surge could impact hospitals' oxygen supplies. 11 Alive's Brittany Kleinpeter has the story new at 5.
First, it was PPE, then ventilators and ICU beds. Now it's oxygen that's in high demand at hospitals. Hospital officials tell me they're worried their supplies could run out if COVID cases don't start to decline soon.
I'm hopeful that we won't have to get to that point where we're making decisions about who gets oxygen and who doesn't. But, doomsday scenario, that could happen.
Anna Adams, a spokesperson for Georgia Hospital Association, says hospitals started seeing oxygen shortages 2 weeks ago. Smaller, more rural hospitals are struggling the most. They aren't used to administering so much oxygen to so many patients.
One of the biggest techniques is to remind the rural hospitals and some other facilities that not every patient needs to be on high flow oxygen.
Adams says the need is so great. In South and Southeast Georgia, they reached out to the governor's office last week for help. On Monday, Governor Kemp announced he's renewing a waiver on truck weight limits and how long drivers can be on the road to get oxygen to hospitals faster. In the meantime, Adams says big hospitals in Metro Atlanta are advising rural hospitals on how to conserve supplies. As of Wednesday, Georgia was coming even closer to breaking a record with 5,700 total patients hospitalized with COVID. That represents 33% of all hospitalizations. And ICU beds are now at 94% capacity statewide. South Georgia remains the worst region for hospitalizations. About 60% of those patients are suffering from the virus.